How you doing?
Hi, Keith from GlaxoSmithKline
Nice to meet
Pharmaceutical
you.
Company. Nice to meet you too. Thank you for taking the time out of your day to meet with me.
Yeah, no problem.
You're a busy man. I seen the lobby full of patients.
They weren't screaming, were they?
No, they weren't screaming.
That's good.
So, yeah, they were pretty calm, so that should be all right for them.
All right, that's good. They can wait then.
How you doing?
Good. How about yourself?
Not too bad. Finally just got back from the golf course a little while ago.
Really?
Yep.
Oh yeah, where'd you go?
Whitehawk.
Oh, yeah?
A recent member of Whitehawk Country Club.
That's awesome. I've been there for about 5 years. It's a great course.
Really nice.
Yeah. Which course do you go?
The silver course.
Oh.
Got to say that back nine.
Yeah, it's tough.
It's
yeah.
a rough one.
You gotta ask how many balls you lose.
I'd hate to say it, I lost about 7 balls in the par 5.
Sounds about right. Yeah.
A couple in
yeah,
the
you
swamp,
gotta hit it. If
couple
you
in
can't
trees.
hit it straight, it's either the swamps, the woods.
Yeah.
It's tough. That's about as hard as it gets there, though.
Yeah.
So.
Well, first off, I'd like to say I did a little bit of research about you. I noticed that you have been in the business for 20 years now.
Yep.
And you only have a 5% turnover ratio.
Yep.
That is, I'd like to congratulate you on that. That is
Thank you.
an impressive feature.
Yeah, I'm proud to say that as myself. It's been tough, but it pays off with hard work. So.
Yes, hard work pays off. There you go. Okay, well, let's get right into this. I'd like to have a little agenda for us today. I'd like to tell you how our medication can work for you and your clients and how it can benefit your patients, like what it can actually do for them that your other drugs are not currently doing right now.
Sounds good. Let's hear it.
Okay, and please feel free to ask me any questions you have throughout the presentations. And while we begin, do you mind if I take notes? Is that
Oh,
okay
yeah,
with you?
not a problem at all.
Okay. Let's see. I'm aware right now that you're currently prescribing 2 different types of medications to your clients, patients. Yep. How are you determining which ones to give them, and as far as dosage-wise, how are you determining
Well,
that?
it depends because I'm using the Maxell and the Imitrex. It really depends on body weight and age, pretty much. If it's a child between 6 and 17, we usually go with the Maxell because it's lower dosages of like 5 milligrams or 10 milligrams, and those are by tablet. If they're over 17, and occasionally if they're a heavier set kid, we'll give them the Imitrex, which that comes in different forms, either 25, 50, or 100 milligrams. That's with tablets, but we also do the nasal spray, which that ranges from 5 to 20 milligrams, and then we also do the injections, which is for 4 or 10 milligrams, or 4 or 6 milligrams. So we don't tend to use those too much, though. Same with the nasal, because if you ever had when you have a stuffy nose, you spray that and you feel it in your gas. It's not, it's nasty. We also do the injections, but that's pretty rare too, because people are afraid of needles. They want to stay away from. So we generally stick with tablets. That's usually what we go with.
Okay, so that's preferred amongst the patients, tablets. Yeah. Okay. How often do your patients come in with their migraine problems? Is it like a monthly thing, a weekly thing? Like, how are you going about meeting with these patients and supplying them with the medication? Well,
since we're a family practice physician, we focus on taking care of the clients. I usually like to see them at least every 3 months around there. So I try to give them 90 days worth of pills. So I do take a pill every day.
They do. They take a pill every single day?
Yeah, every single day, just to make sure, because they don't. I mean, there's some clients where it's so extreme that they have to go to the hospital, so they like to take it every day just to be safe.
Okay.
So that's usually what we go with. And like I said, occasionally they use the nasal, but it's usually only tablets that we'll do it.
Okay. And as far as taking the pill every day, are your patients okay with that? Is that something that concerns them?
It does concern them because, if you ever had a headache, you take a couple aspirin if you have a headache, or ibuprofen. They're taking it every day. So it does concern them, unless it's like a vitamin, then, it's the normal, you're giving yourself vitamins and all that. But since they're just giving a migraine, medication, it does scare some. Some are perfectly fine because they don't want to experience the pain at all.
Yeah, exactly.
But I do have a lot of clients that are concerned with it. I tell them, there are side effects, but it's pretty rare to see anything major. But they definitely are concerned with it.
Okay. If I were to tell you that we had one medication that can do what both of your current prescriptions are doing right now, and you wouldn't have to take it every single day, do you think that would interest you and your patients?
Oh, yeah. Yeah, that'd definitely be beneficial. Like I said, there are concerns. I'd like to do it as well. Instead of having to give them 90 pills, maybe give them 15, something like that. I think it'd be awesome, yeah. Definitely would interest me.
Okay.
I guess one question I would have is what's the benefits compared to, I know like taking a pill, but what's the biggest benefit for my patients to take it?
The biggest benefit for your patients would be, like you said, they wouldn't have to take a pill every day like they're doing right now. They would just take it at the first sign of a migraine. That's all they would have to do.
Is it like an hour or two before, or like after? How does it work?
No, as soon as they feel a migraine coming on, they should take that pill right at that time.
All right.
Not after, not like any time before that, just right when they feel that migraine coming.
All right.
So they don't have a migraine for a day, they don't have to take the pill that day. They just take it when needed. and only when needed.
Yeah, that's nice. I guess working off that, a big concern for me is it an easy transition to go from Maxol or Imitrex to the Trexamet that you're serving us? So.
It's actually a very easy transition. Trexamet actually has the same ingredients that are found in Imitrex.
All right.
The subtributane
All right.
is actually found in Imitrex and it's also in our Trexamet. So the transition for that would be fairly easy for your patients to go through.
All right. Yeah, I like that just because another big thing we use Imitrex more than Maxol is because of the rizatriptan in the Maxol.
Oh, okay.
I've seen quite a bit where our clients are allergic to it. So we're opposed to the sumatriptan. You very rarely ever see it.
Okay.
So like I said, the main reason we use the Maxol is for the low dosage. But if you're saying that it's got, the sumatriptan, how many milligrams does that have of that?
It has 85 milligrams of sumatriptan.
All
and
right.
it also has 500 milligrams of naproxen sodium, which is actually an anti-inflammatory.
Yeah, the anti-inflammatory. Yeah, exactly.
And it's also a pain reliever too at the same time.
All right.
So those two ingredients together in our one pill actually work two different ways to stop the migraine.
All right.
First off, it attacks the nerves and the blood vessels, which are first thought to actually start the migraines, and also attacks the inflammation, which is also thought to cause different migraines in patients.
All right.
So,
Awesome.
So
yeah.
it's one pill that works two different ways.
I guess question off that would be: is it safe to give to clients aged between 6 and 17?
Yes.
Yeah.
Yes, it is.
And is it only tablets? Do you have injections?
It's right now we only have tablets.
All right. Like I said, that's usually what we use, so
Okay.
that's not a concern at all for it. I guess one thing that worries me is right now Maxol. I just had a rep come in last week and told me that they're going to be coming out with an app soon. Do you guys have anything along that lines, planning on having anything like that, or any technology-wise that would benefit me?
I'm actually glad you brought that up. I just got out of a training class. It was a week training. We actually just proposed a new app that's available on all smartphones.
Oh, it's already out?
Yeah, it's already out. So right here, I've got it right here for you.
Oh, cool.
You can actually, if you go on our app, you can actually see the adult dosage, like what they recommend. One tablet orally when needed. Only when needed, as you can see.
Well, this would be nice to have, just, make it a really easy transition like you're saying, because I could just work off this for a while
Exactly.
until
You
I
can
got
work off of
the hang of
this.
it.
You can see the different symptoms like the side effects with the medication.
I guess that would be a question for you is what, it does concern me, is are there any other side effects that could be harmful? Are they the same to what we have now?
There are side effects, like with any medication, any drug, there are going to be side effects.
All right.
The side effects, though, are similar to the ones you currently are prescribing your doctor.
So like heart failure, it's very rare, but heart failure, like heart attack.
Dizziness, upset stomach,
All right.
everything like that. So it's similar side effects, but again, like with any medication, there are going to be side effects.
I just want to make sure it wasn't going to be like something that can, kill me. I don't
Yeah.
want to make my turnover rate any worse.
Yeah, exactly.
I got it at 5%. I don't want
You worked very
take the
hard
chances,
for that.
yeah.
Exactly.
to. So this is really cool.
So that's available right now. So you can easily download that if you had a smartphone right to your phone. You can
So it'd be a smartphone or an iPad.
Yeah, anything.
Cool.
Anything you
Do
want.
you have anything that would work off like our computer system?
Yes, we do.
Cool.
If you actually go to our website, right here. This is
Trexamet.com.
This is the actual website, yes, trustmx.com. They actually have a My Migraine Coach. So patients can actually go to here and they can find out what's actually causing their migraines, understanding what's going on here, like what's the science behind the migraine pains. They can see what's actually, like why are they having the migraines?
Yeah.
They can also go here. It's telling them, is it an actual migraine they're having? Some people have the confusion. They think of right away head pain.
Yep.
They automatically think it's a migraine.
Yeah, I
Doesn't
have a
have-
lot of clients coming in with that, and you're like, oh, our head's killing, but in general, it's just a headache.
Yeah, so this will tell you like this is the actual symptoms of a migraine. So your patient.
That's nice, yeah.
Also, they'll have right here. They can you can discover what actually triggers a migraine and how like different possibilities to avoid that. So your patients possibly, hopefully, in the end, won't have to take any more medication. They
Yeah,
can just avoid those
that's our
migraines in
ultimate
general.
goal. That would be nice too, because people that are starting out to get a migraine, they can see what's triggering it, and that way, if they see something like based on what that says, I guess they could read that and it'll tell them if this is triggering it, they could pop that pill real quick, and they want to experience it.
Exactly.
So that would be really nice
Yeah.
to have.
And there's some tips also right here. Some healthy choices like maybe changing your eating habits and things like that. Just little nice tips that will help the patient actually avoid the migraines in general.
And this could be accessed by clients, you're saying?
Yeah, right away. Just at
Awesome.
trustmx.com, and you can access it. The patients can access it. Anyone can go to it.
Awesome. Yeah, this all sounds good. I guess, biggest concern out of all of them was it FDA approved because, like I said, safety is a big concern to us. Being a family practitioner, is it FDA approved?
Yes, our medication is FDA approved, so it's good to go. You wouldn't have to worry about any safety issues as far as with your clients. You can keep that turnover ratio
Yeah, I don't want
that you work so hard for.
to be bad to deal with that. I had a couple more questions about the tablet. So can you get like the adverse effects on it and all the things like that, like side effects? Does it show it on this?
It actually does. Right here, if I just click on the effects, it'll tell you different effects that the medicine might have on different patients. But then again, all patients are different, so the medication's going to work differently for every patient. So some might not see any side effects. Some might notice a couple different side effects, such as like the dizziness and things like that. But then again, it all depends on the patient, their body type, and how their body actually reacts to the pill.
All right.
So not every patient's going to be the same.
Yeah, I understand. Yeah, this app really does interest me. So what's the benefit of using this because I know Maxalt was going to do an app where you could track it. I guess that's where that can come in. So can they make like a profile? Is that what it is? And
they can. Yes, they can. They
That's-
actually make the profile for them and like their specific symptoms and everything like that, so they can find out all that through that website.
Cool.
Okay, so how's everything sounding for you so far?
Sounds good. Yeah, I guess the concern I had was FDA approved and stuff like that. It does look good. I guess the biggest thing is I don't know how it's gonna work. You know what I mean? Because I don't have because right now I'm prescribing the Imitrex and the Maxalt. How does it work to get like pills in my hand? I guess to give to other customers.
Okay, I brought a couple samples for you. I know you would ask that. I would like you to try these out. Maybe give it to a few patients, see how they go over with it. Try it out for about a month or so. See if that's helping them instead of I'd say switch it from the Imitrex and whoever's taking the Maxalt. Kind of switch it with that. See how they like it. See if it's beneficial for them. See if it actually works out for them. And if it does, I would like to get in contact with you. Maybe set up another appointment in a month.
Yeah,
see how
that sounds good.
And,
because I think I would have a lot of customers that'd be open to try this because I've had, like I said, 20 years. I've had people almost there since day one.
Yeah.
And I've been getting a lot more people. I don't know if it's all the video games are playing, but getting a lot more customers. Up to 25% of my clients now are migraines.
Oh,
So I think
so
I think it'd be nice to try something new, see how it works out for them, and maybe in the long run, like you said, prevent them from ever having to take medication again. That'd be awesome.
There we go. So I would just like to set up another appointment with you in a month and see how that all went through with your patients. And
that'd sound great. Because I actually got to get back to my clients, but that would sound great to set up another appointment.
Okay,
give them a try.
Let's see. How about December 15th? Does that sound good to you?
Yeah, day before my birthday, you can bring me a gift.
Bring a gift?
Yeah.
What do you like?
Yeah, you can bring me some more checks than that. That'd be perfect.
Okay, so it's same time?
Yeah.
Same time? Okay.
Yeah, it'll be perfect at this time.
Okay. Well, I know you're busy, so I'll let you get back to your patients. I saw you, like I said, you had a full lobby out there.
Yeah,
Just get back to your
appreciate it.
busy day. Yep. Thanks for taking time out of your day
Thank
to meet
you.
with me. Yep.
You have a good one.
You too. Thank you.